Hi, I'm Houston Fire Chief Sam Pena. The Houston Fire Department receives close to 1,000 calls for service each day, many related to the medical issues that may not meet the definition of a true emergency. A non-emergency call that results in a transport to the ER reduces our capacity and availability for critical and life-threatening calls. That's why it's imperative that all stations utilize the Ethan Project for as many calls as possible. Since the implementation of the program, the number of ambulance transports has been reduced, and nearly 92% of the Ethan calls are being transported by taxi cabs instead of an ambulance. Not only does this cut costs, but it increases the availability and returns crews to service faster. I ask that you continue to support the Ethan Project's proven capability to streamline the calls and trim the time it takes to get patients the care they need. Thank you.
Thanks, Chief Pena. For those of you who don't know me, I'm Dr. David Person. I'm the Medical Director with Houston Fire Department. Along with Chief Pena, I want to talk about a couple of things pertaining to Ethan to put you a little bit more at ease. One is that we've heard concern about liability and will I be held liable for what happens. And this is one of the greatest things about the EMS program that we've developed here with Ethan, and that is that once you give a good history and physical to the physician and the physician starts making decisions, the liability is no longer on you. Your responsibility is to give a good and complete history and physical. So make sure you get the who, what, when, where, and why and the history of the patient, and make sure you do a decent physical exam. You know, and if it's a twisted ankle, you don't really need to listen to the breath sounds and press on the belly. But if it's somebody with abdominal pain, you do need to do a complete abdominal exam and give that information to the doctor. Once the doctor has all the information, just like when you're at the hospital and you transfer care over to the doctors and nurses at the hospital, the liability is no longer on you. The second thing that we want to talk about is the inclusion and exclusion criteria. And yes, we have inclusion and exclusion criteria posted on the web. And as you read those, make sure that you understand that those are guidelines. So, you know, it talks about pediatric patients. Well, a seriously ill pediatric patient is not going to be a good one for Ethan. But, you know, a child with, you know, who's 6, 7 years old and had a fever for 3 days and a runny nose, that's perfectly good for Ethan. So a little bit of common sense about what's going to be good for Ethan that goes along with the inclusion-exclusion criteria. One thing I want to point out is patients with nausea, and that's all they've got, maybe a little bit of fever and nausea, and they've been nauseated for a couple of days, that's probably fine for Ethan, unless they're actively vomiting. Cab driver's not going to take somebody who's actively vomiting. Similarly, somebody who's clearly in a lot of pain, even though it may not be related to a serious medical illness, if they clearly look like they're in a lot of pain, the cab driver's probably not going to take them. So a little bit of common sense used to the inclusion-exclusion criteria. And finally, there's been some concern about if I present a case to the doctor and it's not appropriate for Ethan, the doctor's going to get mad and there may be some retribution. That is absolutely not something to worry about. Anytime you present a case, if it's not appropriate for Ethan, that's a teaching opportunity. That's an opportunity for my colleagues and I to let you know that, you know what, that headache, it seems like a simple headache, but it has the characteristics that go along with it being a subarachnoid hemorrhage. That's a teaching opportunity so you can recognize that life-threatening headache as opposed to the non-life-threatening headache. So those are the three things I want to talk about. Ethan is propelling us into the future. This is the Houston Fire Department moving ahead and leading the rest of the nation. Thank you.